Our Child Life Department is one of the largest child life departments in the country. We're composed of certified child life specialists, child life assistants, music therapists, hospital school teachers, and art teachers, which that really does make us stand out among other children's hospitals.
From the moment the children walk in to the emergency department, to if they're coming from a clinic setting or just being admitted to the floor, we want to help minimize the stress and anxiety that's associated with hospitalization.
They make it fun. They make it better, something to do while you're in here instead of moping in the bed and watching TV. She helps me not be so afraid to before a transplant or something like that. And she goes down with me and explains everything, and sometimes she'll stay overtime too.
So Child Life's role is to make sure that children and families understand what happens when they come into the hospital. We provide teaching, distraction, coping techniques for patients and families to get them through this most difficult time in their life.
I mean, it's been incredible for us, particularly with Adam and his long-term stays at the hospital. Miss Lindsay is a child life assistant on this floor, and Adam has been immunocompromised so much and had so many infectious disease that we've been a lot of times contained to the hospital room and not able to go out and play. So the child life consistently come and ask Adam what kind of things he'd like to do, and particularly with painting.
I like to paint, and I like to paint pictures about Mommy and Daddy and Austin was my little and sister.
Siblings in particular, I feel like, have a very difficult time. Sometimes their needs are even more dramatic than those of the patient themselves. So one of the ways that we address it is actually at the beginning of diagnosis. We will have educational sessions. We think it's just as important to educate the sibling as it is for the patient.
Well, when Adam was diagnosed back in January, there was a lot of new things that we were facing, and Child Life really stepped up and came to the siblings with Austin, and specifically being old enough and really explained what was getting ready to happen to Adam as far as the surgery. It lets Austin be near Adam without having to, maybe in some uncomfortable situations, not have to be in the room, but know that he's close to him.
He comes to see me and play with me, and sometimes he spends the night.
We also have a certified child life specialist who does school reentry. She goes into the schools and she makes sure that the children or families, their peer groups that she can go to as well, they understand what's happening when their loved one is away from the hospital.
A lot of people outside of the hospital and family, friends, different people that we're in touch with ask me all the time, how do you do this every day? It must be so hard, it must be so sad or so difficult. But the biggest reward as being a child life specialist here at the Children's Hospital is when a child makes you a picture or, totally gives something to you from their heart and as thanks, or a mom, is upset and turns to you and gives you a hug, and you can kind of be that support person and help them through that. It's really rewarding being a part of these families' lives. This is probably their most stressful time ever, is being in this hospital setting. So, to know that you've made that connection with a family member or a sibling or a patient, it means the world.
I would really like to give a special thank you to our donors and supporters of the Child Life Department. Your generosity and support truly make a difference to the Child Life staff members and to the patients and families who come in the doors of Levine Children's Hospital. Thank you for all you do. We couldn't do it without you.